Welcome to our podcast, the Chest Pain Evaluation Guide for Medical Professionals. I'm your host, Dr. Smith.
And I'm Dr. Johnson, your guest for today's episode. I'm excited to be here and discuss the top 10 questions for chest pain history taking.
We're glad to have you, Dr. Johnson. Let's dive right in with the first question, acute or chronic?
When assessing chest pain, differentiating between acute and chronic is crucial for narrowing down potential causes. Acute chest pain may be indicative of conditions such as acute myocardial infarction, dissecting aneurysm, pulmonary embolism, while chronic chest pain might suggest chronic coronary insufficiency, esophagitis, hiatal hernia, or chest wall conditions.
That's an important distinction to make, Dr. Johnson. Moving on to question 2, constant or intermittent?
Yes, Dr. Smith. Understanding the nature of the pain can provide valuable insights. Constant chest pain may raise concerns about acute conditions such as myocardial infarction, pulmonary infarction, or pneumonia. On the other hand, intermittent chest pain could be suggestive of coronary insufficiency, Tietze's disease, or Da Costa's syndrome.
Excellent point, Dr. Johnson. Now, let's explore question 3, associated hypertension.
When evaluating chest pain, it's important to assess for associated hypertension. While it could be related to a dissecting aneurysm, acute myocardial infarction is also occasionally accompanied by significant hypertension.
Thank you for that insight, Dr. Johnson. Question 4, relieved by antacids.
Relief with antacids should prompt us to consider reflux esophagitis or hiatal hernia as possible causes of the chest pain.
That's an important consideration, Dr. Johnson. Moving on to question 5, precipitated or increased by breathing.
Chest pain that is precipitated or increased by breathing should raise suspicion of conditions such as pleurisy, costochondritis, rib fractures, or pneumothorax.
Excellent point, Dr. Johnson. Question 6, hemoptysis.
Hemoptysis, or coughing up blood, should prompt consideration of a pulmonary embolism as a potential cause of the chest pain.
That's a crucial red flag to watch out for, Dr. Johnson. Question 7, fever and purulent sputum.
The presence of fever and purulent sputum should raise concerns about pneumonia as a possible cause of the chest pain.
Important information, Dr. Johnson. Question 8, dyspnea.
Dyspnea, or difficulty breathing, can provide valuable insights in chest pain evaluation. It may suggest conditions such as pneumothorax, pulmonary embolism, pneumonia, or congestive heart failure secondary to myocardial infarction.
Very insightful, Dr. Johnson. Now question 9, aggravated by movement.
If chest pain worsens with movement, it should prompt us to consider pericarditis or myocardial infarctions extending into the pericardium as possible causes.
Thank you for that clarification, Dr. Johnson. Lastly, question 10, relieved by nitroglycerin.
Relief with nitroglycerin suggests a possible coronary insufficiency, but it's important to note that nitroglycerin may also relieve symptoms of esophagospasm.
Valuable information, Dr. Johnson. These 10 questions provide a comprehensive framework for gathering crucial information during chest pain history taking. Your insights have been truly enlightening. Thank you for joining us today on our podcast, the Chest Pain Evaluation Guide for Medical Professionals. We've discussed the top 10 questions to ask when taking a patient's history regarding chest pain.
That's right, Dr. Smith. Let's quickly recap those questions for our listeners: acute or chronic? Is the chest pain recent or persistent? Constant or intermittent? Does the pain stay consistent or come and go? Associated hypertension. Is there a history of high blood pressure? Relieved by antacids. Does the pain improve with antacid use? Precipitated or increased by breathing? Does the pain worsen with breathing? Hemoptysis. Is there any coughing up of blood? Fever and purulent sputum. Is there a fever in presence of pus-like sputum? Dyspnea. Is there difficulty breathing? Aggravated by movement. Does movement worsen the chest pain? Relieved by nitroglycerin. Does nitroglycerin provide relief?
Exactly, Dr. Johnson. These questions help us differentiate between potential causes of chest pain, ranging from cardiac issues like myocardial infarction to respiratory conditions like pneumonia.
That's correct, Dr. Smith. By carefully considering these questions and their corresponding answers, healthcare professionals can gather essential information to guide their diagnostic approach and provide appropriate care for patients presenting with chest pain.
Absolutely. Remember, it's crucial to approach chest pain with thoroughness and attention to detail, as it can indicate serious underlying conditions. Thank you, Dr. Johnson, for joining us today and sharing your expertise.